A hearty good afternoon and welcome to a session on infertility. What may be the reason? We're glad to have Dr. Pratibha Pasari among us to help us understand this topic. There can be many reasons for infertility, and infertility as a whole is something really discussed in the medical community. It is important for us to understand what are the reasons that can be causing this infertility, and the best person to help us through this is the doctor today. The doctor will take us through and answer any doubts that you have related to infertility. So, let's go on with the session. Doctor, you have the stage.
Thank you so much. Hello and a very good afternoon to all. Whenever we speak of infertility, women is always blamed for. Any case of infertility, it is always women who is blamed. So today I'm here to tell about the causes of infertility. It's not only the women, but males are actually responsible. Males are also responsible for the causes of infertility. So, to know the causes of infertility, first we should know how does a normal pregnancy occurs. For a normal pregnancy, we need an egg. In the ovary, there are eggs, and this egg, one of the egg ovulates. In the mid-menstrual period, one of the egg ovulates and comes to the fallopian tube. And at that time, if there is intercourse, then sperms from the vagina, they enter the fallopian tube and fertilize this egg. The egg and the sperm fertilize to form the embryo. And this embryo, in say 5 to 6 days, it comes and attached to the uterus lining. That is the endometrium, and the pregnancy occurs. So for a pregnancy, we need a good egg from the women, a good sperm from the men, and a good uterus, that is the endometrium where this embryo is implanted. So today, when we see the causes of infertility, 15% of the cases of all cases are due to infertility. So of these 15%, one third of the cases, the problem is there in the female. This we call as female infertility. One third is due to problem in the male. We call it male infertility. And in one third of the patients, there may be problems in both male and female. So both are responsible in the other third of the patients, and both there may not be any problem in both of them. So we call it unexplained infertility. So first of all, let us see what are the causes of male infertility. In males, the sperms are produced in the testis. Testis is present in the scrotum. So this production of sperm is governed by hormones which are released from the brain. The hormones are released and it acts on the testis, and the sperms are produced. So if there is any imbalance in this hormone, the sperm production will not be adequate. So any cases where the hormones are imbalanced, the male hormones are imbalanced, the sperm production will not be adequate. If the hormones are okay, the values are in the normal range, then there may be problem in the testis. So testis is the factory where the sperms are produced. So in the testis, there may be problem like there may be infection in the testis, or due to any systemic conditions, just say diabetes, hypertension, or there may be any history of mumps in the childhood. If the husband has suffered from mumps in the childhood, there is effect on the testis, and the sperm production is very less there. And if the husband is getting treatment for any kind of cancer, where he's getting any chemotherapy or radiotherapy, then the sperm production is hampered. So this is the reason where the sperm production is hampered, which is the cause of infertility. And again, if the sperm production is okay, if there's no problem in the testis, no infection is there, the sperm production is adequate. Now this sperm which is produced in the testis, it has to travel through a path to go and mix with the semen. So if there is any obstruction in this path where the sperm travels to go to meet the semen, if there is any obstacle there, the sperm will not go to reach the semen. So in the semen, there will be no sperm. And this condition we call obstructive azoospermia, where there is no sperm in the semen. So this may be one of the cause. And due to environmental exposure, like if the husband is in a job whether he's exposed to chemicals or pesticides, or he's exposed to high temperature, so that may be the cause where the semen are not produced effectively. These are the reasons where the male infertility, reasons for male infertility. And in few patients, they have problem in ejaculation, or they have problem in erection. So these are the problems in males. Now let us see what can be the problems in females for which there is infertility. So in females, the eggs, they are produced in the ovaries. So the production of this egg is again dependent by the hormones which are released by the brain. So the hormones from the brain are released, which acts on the ovaries, and the sperms are produced, and the eggs are produced. So, if there are any hormonal imbalance in a woman's body, the eggs will not be produced effectively. Uh, and if the hormones are okay, then there may be problem in the ovary, where the ovulation cannot occur. And In ovulation, the egg is released from the ovary and enters the fallopian tube. So, conditions which hamper this ovulation, such as PCOS. PCOS is a very common disorder nowadays, which is seen in our OPDs. Many patients which come, they have problems of PCOS, that is polycystic ovarian syndrome or polycystic ovarian disease. So, in this problem, there is no ovulation from the ovary, the egg is not released from the ovary, and when the sperm enters the fallopian tube, it does not meet any egg, and the pregnancy does not occur. So in cases such as PCOD or endometriosis, where there is a chocolate cyst in the ovary, the egg production is again hampered due to this endometriosis. When the ovary is okay, there is no PCOD, there is no endometriosis, then there may be problem in the tubes. Tubal block is again one of the most common cause of infertility amongst females. Now, what is the function of the tube? In the tube, there is fertilization. Fertilization occurs in the tube. The egg which is released from the ovary, it enters the fallopian tube and it meets with the sperm. They are fertilized there in the tube to make the embryo, and this embryo travels for 4 to 5 days in the fallopian tube, and then it gets attached to the uterus. So if there is any block in the tube, the egg will come, the sperm will come, but then both of them will not be able to meet each other because of the block. So there will not be any pregnancy. And why does this block happens? It happens due to any kind of infection in the pelvis, which we call as pelvic inflammatory disease or PID. If a patient had tuberculosis, so in tuberculosis, there are very chances that the tubes are affected and the tubes gets blocked. Again, when there is endometriosis, there is adhesions of the ovary and the tubes, then the tube may be conkinked, and there is obstruction in the tube, or there may be fluid in the tube, which we call as hydrosalpinx. When there are hydrosalpinx, there is the tubes are filled with fluid or the liquid. So there is blockade, and the egg and the sperm will not meet each other. And in hydrosalpinx, what happens? This fluid in the tube, when they enter the uterine cavity, they act as poison for the embryo. So whenever a hydrosalpinx is diagnosed, so it is always better to remove the tube than to do operation for opening of the tubes. Again, if the tube is okay, there may be problem in the uterus. Like many patients, they have benign tumors in the uterus, which we call as fibroids. Now, these fibroids, many people come and say that, ma'am, we have fibroids. So, are we able to conceive? So, these tumors. Firstly, I would like to tell that these tumors are not cancerous. These are benign tumors, and mm, instead of the size of the fibroid, or it is always important to see the location of the fibroid, where it is located. Even a small size fibroid, if it is located or indenting into the uterine cavity, This is more dangerous than a big size fibroid outside the uterus. So whenever there is a fibroid, we need to see the size, the location of the fibroid, what is the type of fibroid. We need to look for that. And the patient may have adenomyosis, which is the swelling of the uterus. The uterus becomes bulky. When the embryo is implanted, it is not implanted nicely and the pregnancy fails. So fibroid adenomyosis again. This embryo which is implanted in the uterine cavity, this uterine cavity, or which we call the endometrium, it should be adequate thickness. It should be of adequate thickness so that the when the embryo gets implanted, there is a connection between the embryo and the uterine cavity, the endometrium, so that the implantation occurs easily and pregnancy occurs. But if the endometrium is thin, then there are problem in implantation. So we also need to look for the endometrium. If the endometrium thickness is less, we need to take measures to improve the thickness of the endometrium. So these are the broadly these are the causes of female infertility, and there are certain conditions which is associated with infertility, both in males and in females, such as alcohol consumption. If both are taking alcohol, alcohol reduces the egg quality and quantity in the women, and also it reduces the quality and quantity of the sperm in men. So alcohol consumption, then again smoking. If a person is smoking, this tobacco is very much harmful for the both the eggs and the sperm. The gametes, they are destroyed with this tobacco. Again, if the patient is overweight, obesity, or the patient is underweight, this also hampers fertilization. Again, if a patient is having systemic conditions like diabetes, thyroid, hyperprolactinemia, so these are the associated conditions which lead to infertility. So broadly, as I had said, for infertility, males and females are equally responsible. In males, as I told you, the problems, where can the problem occur, and also in the females. So we now know the causes of infertility. So, but in gynaecology nowadays, many of the patients, they come with number one, poor ovarian reserve. Now, what is this poor ovarian reserve? What is ovarian reserve? Ovarian reserve is a number of eggs in your ovaries. Like when a female is born, she is born with approximately 10 lakhs eggs. So when she has a first menstruation, this number decreases to 2 to 3 lakhs. And with every menstrual cycle, she releases 15 to 20 eggs in every menstrual cycle. So the total number of eggs they gets diminished every time. So the reproductive potential, most important, is in the 20 to 30 years of age, and after 30 years, the potential it starts declining till 35 years of age, and after 35 years, it declines very rapidly to become almost nil at 40 years of age. So age is one of the most important factor responsible for infertility. Age is directly responsible with infertility. If the age advances, the infertility is more. So the reason we now know is the number of eggs. As the age advances, the number of eggs, the quality, the number, that is the quantity, and also the quality of the eggs, it decreases. So it is very important to have pregnancy at this desired fertility potential period, that is in between 20 to 30 years of age. And with the stress people are having nowadays, this age 20 to 30 is still when at 30 year also, when a woman comes, she has very less number of eggs nowadays. So stress is also a very important factor which is diminishing the egg and the sperm reserves. So try to avoid stress. If you're taking alcohol and smoking, please try to stop that. If you're overweight, try to lose your weight. If you're underweight, try to gain your weight. Please try to stay in the optimum BMI so that your fertility potential increases. The factors which are modifiable, we can modify that. But the factors which are not modifiable, we are there to take care of that. So please take care of all your problems. And for any problem, do visit us, Apollo Fertility Guwahati. We are there to help you. Thank you so much. Any questions? I would be happy to take any questions if there are any. If there are no questions, let us wind up here. Thank you so much.